get something done, and you're not looking through the label of being a Democrat or Republican. There's a concept. I kind of wish others who are Democrats or Republicans shared the same zeal. Judge, thank you very, very much. All right, I want to update you on a couple of other things we're following right now. The fallout on this, finding out about the Supreme Court leaker, but more importantly, the ramifications of that leak and what it could mean. Lo and behold, a long time ago, Justice Antonin Scalia had warned this day would come because a couple of other times it has, and how the Supreme Court reacted and what got him very concerned for this very day that he seemed to predict to a T. His son Chris on that after this.
Sickle cell disease, and I wonder what your thoughts are about those populations, as well as are there other modalities to be used for that? So I have to admit I don't know. Yeah, go ahead.
Yeah, so Mobic, if I'm not mistaken, it's meloxicam. So that's actually a non-steroidal anti-inflammatory drug. I wasn't aware that it was widely available in the U.S. My understanding was it was more commonly used in Europe. But with NSAIDs, you do need to make sure that you're taking them with food in your stomach, because depending on the type of NSAID, you don't want to run the risk of getting a stomach ulcer. And then you don't want to take them in too high of doses for too long, because depending on...
Maybe 7.5.
The dose or the dose?
It's a generic for Mobic. It's a generic.
Okay. So to answer your question, I wouldn't be so much worried about addiction. But Mobic, like any other medicine, has side effects. So I would certainly only take it as your doctor prescribed and not take it longer than prescribed. Because you run the risk of...
Is gabapentin better for you?
Well, it's a...
Go ahead. Yeah, that's a great question. So gabapentin falls into another class of medications with a medicine called pregabalin. It's commonly prescribed as well. And that's more for nerve type pain.
Oh, okay. Okay. Well, I do appreciate you answering my question.
Oh, you're welcome. And I learned something. I don't know that I've ever heard of Mobic. So thanks, Sam. Hopefully we helped you. And now we have Georgine from California. Hi, Georgine. How are you?
Hello. Good, thank you. Would you like my question?
Yes, of course.
Okay. I wanted to know which you think is the best painkiller to take for someone that has chronic fatigue syndrome.
I'd honestly have to say that that's not my area of expertise. Have you tried certain medications in the past that have been beneficial for you?
Not really. No, this is the trouble. It's like nothing really sort of does too much.
What are your primary symptoms?
Yeah, exactly.
Oh, well, apart from the fatigue, I've got sort of muscle ache, joint ache, and then all the ones that don't involve pain, like a sore throat and all that sort of thing,
Have you seen a pain specialist?
No, where I live is very rural and remote and basically not available, pain specialist.
Where do you live exactly?
Right on the Oregon-California border.
I see. So I would say that OHSU, the Oregon Health Sciences University, I believe would have a very robust pain medicine program. And there's universities such as the University of California, San Francisco, that have well-developed pain programs as well. So what I would suggest is actually seeing if you can get a video to discuss your symptoms with a specialist. And that's one of the silver linings really of COVID, is we can do that.
Okay, yeah, that's like a 6-7 hour drive from me. So yeah, that would be wonderful.
So a video does it even on your cell phone.
Yeah, okay. All right. And then would I need a referral from my regular doctor, or can I just do it myself?
I would contact the pain clinic and ask what they need from your regular doctor.
Okay. All right. Oh, thank you so much. That's great.
Oh, thank you for calling in, Georgie. Okay, so now I'm going to get back to my question, which I interrupted because I didn't want to make people wait who had called in.
Right. Children with cancer.
Children with cancer and children with sickle cell disease. Generally, those are populations that still get significant opioids, but what do we, are there newer drugs that we can give them, or are opioids still the standard of care for those populations?
So I would say, again, my expertise more surrounds perioperative pain management.
Yes.
Traditionally in my field, what we do say is that children with oncologic diagnoses, because generally they cannot take NSAIDs,
correct,
and those who require palliative management for pain, this is the one area where either acute and, in the palliative case, chronic opioid use is still indicated as prescribed by a patient's oncologist. And frankly, I don't have very much experience with management of patients with sickle cell with regard to newer data and evidence. But
go ahead.
Sure. So there was a really influential review that was published by a group of surgeons back in 2020. It was actually the first set of guidelines that looked at opioid prescribing during and after common pediatric surgeries. And this was done by Dr. Lorraine Kelly Kwan and her group. And so based upon this, and knowing that approximately, we believe 5% of adolescents who receive an opioid prescription for surgery go on to use them between 3 to 6 months after surgery. And if you think about that, that's kind of unbelievable. They've never had an opioid before. They get one prescription and then they're still using it when they don't need it 3 months later. So that was the motivation for my group study.